Welcome to our first lecture of the semester, Introduction to Public Health. My goal for each of these lecture videos is to keep them short and sweet. I've also tried to slim down my PowerPoints so that it's the most basic, relevant information that you can then apply to a variety of videos, podcast episodes, websites, and articles that we'll be reading and enjoying along with the basic lecture content. So I just first want to start by saying that my goal for you this semester, this summer, is that by learning about public health and public health nursing, that your heart and your mind will be opened, not only to the big picture of what public health looks like and what it means to treat populations and communities and not just individual patients, but also I hope that your heart is broken open for those that are the most vulnerable and the most needing of health care around us. So that is my primary goal for you this semester. So let's get started here. I first want you to, when you're reviewing these PowerPoint slides, and even just now, stop, listen to this, or watch this video. It's very short, just a few minutes. It's put out by our premier public health organization for the country called American Public Health Association. And it's a video that just kind of gets you thinking about what is public health. Do you come in with any preconceived notions of what public health is? Maybe you feel like you don't know anything about it. Maybe you feel like you know a lot about it or you've worked in public health. So I'd love for you to just begin brainstorming about what you are bringing to this class as far as your conceptions of public health as a healthcare and nursing specialty. I can tell you that these are the primary definitions that we use as public health organizations for what health is. This is a good place to start. This comes from the World Health Organization and also from the Institutes of Medicine, now known as National Academies. Basically, it's identifying that health is so much more than physical health, and that when we're looking at someone's well-being, and when we're looking at promoting health in individuals, in communities, in populations, we're looking for a state of complete physical, mental, spiritual, and social well-being, and that we want to go beyond the primary definition that we've had in the past, where it's just the absence of a disease, a diagnosis, an injury. We want to go beyond that. And how can we promote the greatest well-being possible in all of these different areas for individuals? And not only in the absence of disease or injury, but sometimes it's in the presence of disease and injury that we cannot fix. How can we create optimal health in the midst of that? And so public health takes that personal health definition and then applies it to a collective group of people, and what can we do as an entire society to create conditions where optimal health is most likely to be achieved. I'll let you kind of read a little bit about this, but basically our main vision and mission for public health in America was started in the early 90s by a group of key national organizations such as the CDC and the HRSA, HRSA, and expanded on a report that came out in the 80s from the Institute of Medicine about the future of public health. And this is what we are aiming to do on a national level. These are just a few of the ways that public health responds, prevents, promotes health in our nation at federal, state, and local levels. Currently living through a pandemic, so obviously that is the #1 priority of all public health agencies currently. But they also look at other things like how can we decrease environmental hazards around us? How can we prevent injuries? Things such as child seatbelt and car seat laws are a huge way that public health has advocated to prevent injuries. How can we just do general promotion of healthy behaviors such as good diet and exercise? How do we respond to disasters, whether it be a pandemic, whether it be a natural disaster, or a man-made disaster such as 9/11? And then how do we look at our system and make sure that we are providing quality healthcare and that everybody has access to that healthcare? So these are some of the top priorities that public health agencies are constantly looking to. I'm not going to read all of this here. I'll let you kind of peruse this, but this is just an example of some recent health threats that we've experienced on a national level: an epidemic, a foodborne illness, hurricanes, and of course 9/11. There's more details here about Hurricane Katrina, not only the economic impact, the health impact, and the long-lasting psychological impacts that often great disasters have on communities. And of course, 9/11 was another enormous example of that. And what both of these examples tell us is that disasters create widespread havoc on the different aspects of our health mentioned in our definition, and then they promoted long-lasting changes in the way that our national public health agencies prepare and respond to disasters. Another thing that public health is incredibly interested in is the top 10 causes of death. I'm curious if you can maybe pause this video for a second and try to jot down as many as you can come up with that you think are in the top 10 causes of death. And here they are. Just to finish out the text here, the number 3 top causes of death is chronic lower respiratory diseases. Number 4 is stroke and neurovascular incidences. And then let's see, number 8 is influenza and pneumonia. And number 10 is the newest to our top 10, unfortunately, and that's intentional self-harm, including suicide. Real quickly, medicine. What we know of medicine, nursing, we try to save one life at a time, individualized patient care. But guess what? Public health tries to save millions at a time by big picture, working, research, advocacy, policy. Thanks to public health, we've gained an extra 25 years in our life expectancy over the last 100 years. Now this chart just goes up to 1996, so I looked up the most current life expectancy data we have is from 2017. Our life expectancy is now at 78.6 years. Doesn't sound all that great to me. And as we'll see later in the semester, when we look at other first world countries around the world, we are doing actually pretty poorly with our life expectancy currently. Again, I'm not going to read these, but I encourage you to just explore these and think about, are there any in this list of the top 10 greatest US public health achievements in the last century? Are there any that are especially surprising to you or things that seem like a complete no-brainer? Fluoridation of drinking water might be one that surprises people. So how has public health extended life expectancy? It's through the framework that they've provided us with their 10 public health essential services that all lie within these 3 core functions. So I have a couple slides coming up. I also have a handout that I have put in your assigned readings for the week. And so just kind of peruse these different ways of learning this, but this is essential for this class. It's essential for the major paper that you're going to write. You do need to have a well-developed understanding of what these 10 essential functions are. This is not just for public health nursing, for all of public health professionals, and how they fall within the 3 core functions. Again, this is information telling us where this came from, the same place where the mission and vision came from as well. And so they're listed here in list form. And then on this slide, they're in the wheel form. So for visual learners, this is more helpful. This is how I like to visualize it. And I will often refer to these services as from the wheel. Notice that research is at the center. Begin to think about why research would be at the center of all of this. And evidence-based practice, or EBP, is a good guess. And then this slide goes through and looks at, kind of describes them in a little more detail, what each of these services means. And we'll be referring back to this all throughout this class. And then you can look at the public health system in a different way. So those are the overarching services that we provide as public health care professionals. And then these are all the different types of agencies that make up the public healthcare system. So public health agencies, such as our County Health and Human Services Department, which is definitely in the forefront right now and in the news all the time, they're in the center. But look at all the other things that are also involved: neighborhood organizations, nursing homes, community centers, hospitals and doctors are there, but they're not all of it. Fire departments, correctional facilities, our politicians, our law enforcement, tribal health, mental health. You can just take a look and peruse all the different agencies that need to collaborate together to promote the health of our communities. And this is just a different way to look at that same thing. If you're interested in knowing about what generally local public health agencies do, this is an example of overall as a country where our local health agencies are providing most of their services. So immunizations and infectious disease surveillance and control are at the top of the list by a long shot. And I love to end with this quote from Institute of Medicine. It says, the determinants of health are beyond the capacity of any one practitioner or discipline to manage. We must collaborate to survive as disciplines and as professionals attempting to help our communities and each other. And I think that in our current pandemic, where there has been just a cacophony of voices and differing opinions, differing agencies, political and health, all trying to weigh in on how we should deal with this pandemic, it is clearly more important than ever that we need to have collaboration, that we need to respect our expertise, each other's expertise, and work together to solve this global and national crisis.